Our last spirochete genus is Leptospira. There's a lot of, as with lots of bacterial taxonomy, there's some debate around the classification versus like what we talked about historically, what we talk about with nucleic acid sequencing. So for our purposes, there are pathogenic or non-pathogenic Leptospira. Obviously, this is med micro. We are far more concerned with the pathogenic variety. They have hooked or coiled ends, so they look a little bit different from the other spirochetes under microscopy. Unlike the other spirochetes, which are microaerophilic or even kind of border on anaerobic, Leptospira are obligate aerobes, and they grow best between 28 and 30 degrees. Culture is complex, just like with Borrelia, but it is possible. Infection with Leptospira can cause no symptoms, it can cause mild flu-like illness, or severe systemic disease leading to death. It really depends on the number of bacteria that are gotten into the body, the virulence of the strain, and the overall health of the host. They are highly motile, like all spirochetes, and they are able to penetrate intact mucous membranes, or if you have a small abrasion in the skin, they can get in that way too. They multiply rapidly inside the body, and they are detectable first in the blood or cerebrospinal fluid, then in the urine. They like to go to the bladder for some reason. Borrelia does it too. It'll go to the bladder, but that's where they like to go. Antibodies are important for clearance. We don't see as much antigenic variation. They do show antigens on their surface, so they're a little bit easier to clear with antibodies. And some of the clinical manifestations are from the immune response. The bacterium is found worldwide. There were almost 100 cases in the US in 2019, but it is thought to be underreported because, again, some patients may not experience any symptoms. Some might have a mild flu-like illness. Really, you're talking about the patients who have severe disease that are probably going to be diagnosed. The most common reservoir hosts are rodents, and it's often found in rodent urine. So one of the best ways to prevent getting an infection is to keep your home free of rodents. Humans and dogs and other organisms are incidental hosts. If you've ever been to the dog park, sometimes they'll have signs that are like, be careful of leptospirosis. So again, this is an organism that is often transmitted in the urine. And I don't know what it is. Dogs have this amazing sense of smell. If you open a package of food, like the dog will come running from wherever. But when they find a puddle of pee, they really just want to put their whole face in it. And because their nose is a mucous membrane, the bacteria can burrow into the dog's nose and cause leptospirosis in the dogs. And then if people walk around and maybe step in urine, if you have a cut in your skin, the bacteria can get in and infect people that way. So if you ever wanted a reason to not participate in a triathlon, I always am like, oh, well, this is my reason that I don't do triathlons, when the real reason is I couldn't possibly ever. But that's okay. There are a number of reports of leptospirosis in athletes participating in water sport events. So this is leptospirosis in triathlon participants in Illinois and Wisconsin. So like over 1,500 individuals participated in 2 triathlons, late June, early July. The definition of leptospirosis used for this investigation was onset of fever, followed by at least 2 of the following symptoms: chills, headache, muscle pain, diarrhea, eye pain, or red eyes. Guess where it got in the body? Generally in the eyes. 9% of participants met this case definition. So we're talking about approximately 1,500 people participating in this event, and over 130 meeting this case definition. 2/3 of them sought medical care, including 1/3 who were hospitalized. So let's really guesstimate like 40 or so, 40 to 50 patients who were hospitalized. Leptospirosis was confirmed in a portion of these patients by serology. These outbreaks illustrate the potential danger of swimming in contaminated water, the presentation of leptospirosis in a previously healthy population, and the severity of disease that can be experienced. Triathletes are usually some of the healthiest people on the planet. They can swim for a long distance, they can bike for a long distance, they can run a marathon all in one day. And like 50 of them were hospitalized by this infection. So it can be a very dangerous infection. They are very thin, so conventional microscopy is difficult. Culture is possible. There's some of the faster spirochetes, between 6 and 16 hours of doubling. Generally about 2 weeks until you have a positive culture. For urine, you want to, if you suspect leptospirosis, you want to collect the urine, concentrate it, and also raise the pH, because the acidic pH of the urine can eventually lead to the destruction of the bacteria that are in there. So nucleic acid tests and serology are best. Not generally fatal unless a patient develops jaundice. That means you have severe systemic disease. It can be treated with antibiotics. It is recommended that you vaccinate your pets. This is one of the spirochetes for which we actually do have a vaccine. And also rodent control to make sure there's no rodent urine anywhere in your environment.